Let me make a couple of remarks ahead of time. Number one, I will be stepping out, and I think Dr. Harris will be here a little bit later to actually sit in the chair. I've got some constituents at another committee, and then I'll be coming back. So when that happens, please excuse me for that. Don't do it often, but you know, nobody wants to tick off the Choctaws and the Cherokees, so it's just not a good thing to do. So we'll go through that second. I believe our ranking member of the full committee, Ms. Lowy, will be coming at some point, and when she does, she's trying to move through a lot of committees, so we'll, whoever's questioning will finish up and go to her for any opening statement she wants to make or whatever, so that might change the order a little bit. But good morning. It's my pleasure to welcome you to the Subcommittee on Labor, Health, and Human Services and Education to discuss the fiscal year 2016 Centers for Disease Control and Prevention budget request. I'm genuinely looking forward to your testimony, Dr. Frieden. I'd like to publicly thank you and your staff at CDC for hosting Dr. Harris and myself recently in my first visit and for giving us a briefing and tour of the campus. I think it's safe to say that certainly all of us that were on that left CDC with a profound appreciation for what you do and for the wonderful work that goes on there for the American people and frankly for people all over the world. The CDC is a leading public health agency monitoring, investigating, and taking action to resolve complex public health problems in the United States and frankly around the world. Your budget assumes many areas of enhanced focus for antibiotic resistance, global health, prescription drug abuse, and continuation of eradication of polio. Of course, the CDC is still actively engaged in the Ebola fight, and in fact, we expect to have an oversight hearing on Ebola in the near future. And very appreciative of the work that you've done in that area, again, not just for people in our country, but around the world. Public health is an important federal role and certainly something that we all generally support. Fortunately, right now, sequester is still the law of the land, although we can work on that, and maybe we can work through that over the course of this fiscal year. And given the reality of funding, we may not be able to do everything in every area that the administration is proposing, but I certainly think this is an area where there's a genuine bipartisan desire to get something done. I look forward to having a discussion with you this morning on your top priorities for the year, given our funding constraints. I also look forward to discussing in greater detail priorities I know we all share, such as reducing opioid abuse and antibiotic resistance in our country. There are many public health threats facing our nation, and we on a bipartisan basis want to give you the resources you need to combat them. I want to caution you, however, that we also want to ensure that precious taxpayer dollars are not wasted or on politically motivated activities, and that we maintain the appropriate focus. Today we welcome Dr. Thomas Frieden, the CDC Director, to the subcommittee. Dr. Frieden is accompanied by two of his center directors who can assist in answering specific member questions. They're Dr. Beth Bell, who was again kind enough on our tour to join us and was extremely helpful, Director of CDC's National Center for Zoonotic Vector-Borne and Enteric Diseases, and Dr. Ann Schuckett. I hope I got that right. Thank you. Dr. Frieden gave me a little heads up. Assistant Surgeon General of the United States Public Health Service, the CDC's Director of National Center of Immunization and Respiratory Diseases. As a reminder, subcommittee and our witnesses, we will try to abide by the 5-minute rule. And before we begin, I'd like to recognize my distinguished ranking member, good friend, Ms. Delora, for any opening remarks she cares to make.